Dr. Chijioke Kaduru has over 15 years of experience really working in multiple geographies. You've implemented various health initiatives, designed programs to improve the health system, to build resilient health system, and your insights are particularly very helpful or useful now, given that we're discussing the context of building resilient systems for climate change. About you now, talk a bit about your vision for the health system, health security. There's something on you have this bio, right, on your Twitter and on LinkedIn. It says, I'll just read it out. 10 people, mainly young and mostly poor, die yearly from conditions from which safe, effective, and affordable prevention and treatment exists. We are changing that. That's very inspiring. And in the context of the work you've done in Nigeria and out, right? Help us understand what that catchy phrase is and what building resilient health systems means to you. And of course, from your experience so far working in this space over the last 15 years.
Yeah, thank you very much, Emeka. And it's a pleasure joining you on the show. And I'm definitely looking forward to this Future of Health conference, particularly because of how topical the issue that it addresses is. Talking about myself can sometimes be difficult, but I'm a physician. I work in public health, been working in public health for over 15 years across multiple sides of public health, both from implementing at field level in communities, in districts or local government areas, as the case may be, to supporting leadership decision making at the very highest levels, depending on what the context is. I think that for me, the catchphrase is really around understanding what needs to be different in our health systems and in how our health systems operate. I think that what we are fundamentally missing as a low middle income country or a country that is sat in sub-Saharan Africa is that we're dealing with a lot of preventable deaths that are happening among the youngest people and among the poorest populations as well. And until we are able to build health systems that cater to all of the people within a country equitably, we're ultimately going to leave people behind. And there shouldn't be any efforts that are targeted at improving our health system that is ultimately going to leave someone behind. And so if we turn our focus to the things that are preventable, but at the same time that target some of the hardest to reach, furthest to reach, and poorest populations, then we might actually build a fairer and more equitable world through the work we do in health. I think that's for me really the guiding philosophy across all of that. And so whether the work we're doing is in providing technical assistance, or it's in doing research, or it's in testing innovations, as the case may be, I think that when we remember why we do it and when our focus is really on those populations that it serves, then we're sort of able to bring different experiences to bear and do the work the best way that we can, as the case is.
Yeah, that's actually very interesting, and I think what you say just resonates with that catchy phrase as well. You're as strong as your weakest link. Basically, you can leave no man behind. Just focus on global health programming around ensuring the vulnerable populations that we're catered to. And it's interesting in the context of the conversation we're having now on climate change, how countries like Nigeria and Africa were the most vulnerable. But we are not among the biggest contributors to carbon emission and climate change, if I'm to say, right? Does that give us a lesser responsibility, or means that, or how do we capture the narrative whereby we are willing to contribute or help address this crisis? Some people have more responsibility in this area.
Yeah, so I think that maybe the conversation around who's responsible or more responsible or not for industrialization and ultimately its contributions to carbon emissions and climate change, I think that sometimes is a bit of a misplaced conversation. I think that the focus on whether or not, as someone from an African country, my country has strongly contributed to a change in climate, I don't think that needs to be the focus for us. I think that what we have to come to terms with is the fact that the brunt of climate events will be borne mostly by women, by children, and by the poorest populations. And we contribute quite significantly to those populations. So whilst you can have a debate all day about who's the more responsible person for climate change, I think that the focus from the perspective of someone from a low middle income country like Nigeria is, how is my country best positioned to adapt to the extreme events that will follow a changing climate? And I think that that's what we need to center the conversation on. I think that if we center the conversation on that and center our engagements with the wider global community around that, then we're better able to identify opportunities, mobilize resources, and put in place very key interventions that ultimately help make sure that when the shocks come, our system is better able to respond. Whilst we may not have data about the significance of the impact that we're feeling right now, I think it's important to recognize that we're already living with climate change and its effects, right? And the moment we recognize that, then we have to come to terms with the fact that people are already suffering the consequences, right? Yeah. And in the context of a changing climate, one of the more tangible ways that we feel it is in extreme weather events. And you and I know that in Nigeria, over the last 5 or 6 years, there have been multiple extreme weather events that have contributed to flooding in many parts of the country. With each of those flooding episodes came an increase in incidents or cases of malaria that were happening. Post-flooding came an increase in outbreaks like cholera and meningitis. During the flooding itself, there were disruptions to health service delivery. So fewer kids got vaccinated, fewer women got delivered by skilled bed attendants, fewer people went to antenatal care. We're already feeling the effects in real time on the ground. So we have to change the conversation. We need to focus on what are we going to do about these realities that are in front of us? How do we find the resources to ensure that a system that is already weak, that needs strengthening, is also in a position that when the shocks come, can actually respond to shocks? And at the moment, I don't feel like we're having enough of these conversations.
Yeah, absolutely, because what you've said just touched upon, the need to take responsibility. And during the COVID-19 pandemic, we saw how it was re-echoed, the whole of society approach, right? And this, there are many parts to this. There's a part that, reminding us how we are mostly reactive. Right, and it's not just a Nigerian thing. We saw with the 2014 Ebola outbreak, we rose to respond. Everybody sort of like remembered what hand sanitizers, the role of hand sanitizers, right? Mm-hmm. And some people even died from saltwater baths, right? But if you look at that, that was like a result of being over-responsive, but in the wrong way. Right, and with COVID, we saw how masks, right, became a thing. It was flooded the markets. Everybody, both people that used it and just got it just to stay safe without even using it. It's all good. We took some course of action, and right now it seems like I often think with climate change, what needs to happen to be that wake-up call, right, to get us back on our feet, to get everybody taking responsibility of being aware of how they should take responsibility, right, to address this crisis, because it seems like it's a silent crisis, an invisible crisis.
So, in context, right, I would say that there are a lot of things that are happening, right, across different agencies of government, different private sector entities, different multilateral organizations as well. And ultimately, all of these things at some point converge towards helping us sort of adapt to climate effects, right? But we, as a country, have consistently demonstrated the ability to silo every conversation. And so everyone is working in a very niche pocket, and they're then only able to have a very small effect on the results. So colleagues at NIMET will tell you that, well, they've shared methodological projections about what changing rainfall patterns are going to be, both in terms of the timing, but also the amplitude of the rainfalls. We're already anticipating that there will be floods across a number of states over the coming months. Whether those floods are from opening of dams and overflowing riverbanks, or those that are being driven by floods or by rainfall as an extreme weather event that is then superimposed on an already raised riverbed, as the case may be. Those projections have been put out. But then how well are other agencies of government who are working in other aspects that need to help respond to that reality? How well are we engaging on those conversations, right? If you think at the subnational level, think about all the states in the Niger Delta, right, where there's already a clear risk that we're anticipating an extreme weather event. What are they putting in place today to ensure that when there is a disruption to the health service, we're still able to provide a service? Whether it is moving a health facility and its service provision away from the permanent structure to a temporary fixed site somewhere that is at a higher plane that ultimately makes sure that you can still deliver services. Whether it's about rethinking how you're enumerating your community members that should be benefiting from a specific service, right? Whether it's around, for example, name baseline listing of children who are due for vaccination. Knowing that if those kids miss their vaccine shots over the next 3 months, then they are higher risk of vaccine preventable diseases. But these things can happen at a subnational level in LGAs, in states, in response to the communication from NIMET, working with NIMET and understanding the data that NIMET has shared. Right? But how often do you see that movement or those conversations? We will always wait and say, well, God will protect us and then nothing is going to happen. But then when it happens, we're now stuck in response mode, right? So when we try to think about what needs to happen differently, it's really just more people talking to each other and people providing leadership for that to happen. If we get more cross-sectoral collaborations and conversations around extreme weather events that are, again, a part of the bouquet of a changing climate and how those impact on health services, whether directly or indirectly, and start to think through from a planning perspective, whether strategically or operationally, how do we get ourselves ready, right, to make sure that when this comes, and sometimes it now feels a bit inevitable. So when it comes, and if it's inevitable that it will come, how are we making sure that women and children are not cut off of services that they need, that are life-changing or life-saving, as the case may be. So I think for me, that would really be centering the conversation is how do we provide leadership for stronger collaboration between the different entities that need to be a part of the conversation if we'll be able to deliver adaptation and mitigation strategies for climate change.
What's your outlook for the future with regards leveraging the modeling capacity to really design the kind of agile interventions we need to address this, to address malaria in a changing climate?
Right. So, did we think about it to the depth that we have over the last 2 years of that project? Definitely not at the beginning. Right. When we started out, yes, climate change was on the horizon as a potential, contributor or something that could potentially shift the landscape, right? And we'd already started to see extreme weather events and how they were directly or indirectly impacting on malaria outcomes as well. But it wasn't really a driver at the beginning, right? But the way we roll out the fellowship, it's a competency-based training for public servants, right, who are already working across the One Health ecosystem. So they're in health, they're in agriculture, they're in the environment. So all of those sectors that ultimately have to come together to be able to respond to any disease context that we have, right? And what we're looking at is building that capacity for them to be able to build models from scratch, not just about them, playing around with existing models or simulating with existing models. But if they have that capacity to build models, they then go back to their primary institutions, and that becomes a competence that is domiciled within that institution as we go forward. Now, that provides an opportunity for them to be able to build models that work routinely, for them to be able to calibrate the existing models with the data that is already being collected in their workspace. And they are then able to think about different intervention mixes, whether for malaria or for other diseases, as part of their routine work, right? So think about all of the colleagues that have experience with managing data for Lassa fever, for cholera, for meningitis. If we empower them with these modeling competencies, they are more likely to be able to apply mathematical models or geospatial models, as the case may be, to their work routinely. So again, that's the aspiration. And we have already seen a few capstone projects that are toying around with some of the components of weather and how they affect transmission dynamics for malaria as is. Now, globally, there are very few models that have been able to try to unpack climate change's direct effects on malaria. And it appears to be one of the more complicated issues to study, as the case may be. But again, that's an area that we need to study more, especially from the context of a low middle income country where we know that we would ultimately bear the highest brunt of the effects of climate change, ultimately on malaria and also on some of the other health outcomes as well. So we sort of need to take more leadership of some of these kinds of studies so that we're bringing out nuanced and contextualized findings that are, very easily applicable within our environments.
Yeah. Wow. I'm just thinking about how modeling is, even up until a few years ago, it wasn't really common for me. In fact, I don't even know how common it is for me right now of what modeling is. And I'm just thinking about, we're talking about malaria. Like almost every Nigerian can relate to malaria. Like since I was young, I've had malaria, so many times. And everybody has this, but not everybody can sort of break down this concept of modeling or predicting possible occurrence of malaria. Or the average Nigerian, just like the person I said that tweeted earlier, waiting concern me with climate change. What does climate change have to do with me? They might have gotten comfortable with the concept of just easily treating malaria, especially since they can easily, even without a diagnosis, go buy anti-malaria drugs, right? And they're like, oh, okay, what more can I do, right? This would always come. They can't draw that connection of climate change and malaria. And they feel that, even if it comes, I can easily treat it. It's not as big as a problem as it is to other socioeconomic issues I'm dealing with. I mean, how the country is right now. How should they be hopeful? What should they be what should they what should they anticipate from all of these predictive capacity and the ability to forecast and predict possible malaria occurrence?
Look, I think it's important for people to understand very practically, right?
That
there are many tools in our toolbox in the fight against malaria. Modeling just happens to be one of the tools in the box, and even in that box where modeling exists, there are many other analytic approaches that ultimately help inform decision making, right, for malaria and the wider health system. Is that people should understand that the vaccine is just one tool, right? None of them are going to be a magic bullet ultimately, right? If someone asked you what would be an ideal magic bullet for malaria, what you would tell people is, well, guys, everybody should sleep under a mosquito net, right? That would be your simplistic response to a magic bullet. But realistically, there are no magic bullets. You're going to need to combine a mix of an array of things to ultimately get us to malaria elimination. I think that what I would say to an average everyday person would be, whilst you may think that malaria is not as much of a problem because you figure you can get tested and treated for malaria, you have to think about the economic impact that malaria has on you as an individual and ultimately on the country and the society as a whole, right? Think about the loss of productivity that happens from having malaria, from having days off from work. Think about how all of that sort of sits in. I mean, there are a lot of graphics that show you that Africa's GDP is essentially held back by the malaria burden that the continent has because of how it impacts on people and, on productivity in general, right? And that's not even looking at the context of then you shelling out some of the hard-earned money that you have or resources to actually seek treatment, right? And this landscape is even worse when we think about children or pregnant women who are more likely to suffer extreme outcomes from malaria. Right, so I think that for me, the counsel to an everyday person would be malaria is a serious enough issue. Where we should always sleep under a mosquito net because it really ultimately helps. Where we get tested and are being treated for malaria, we should endeavor to adhere to completing our dosing cycle and our medication so that we're not also contributing to resistance that ultimately then hurts everyone as we go forward. I think that's what I would say to an average everyday person. But other than that, from a wider program perspective, all of these tools help, but none of them is going to be a magic bullet for us.
Right. I mean, but I would love to take as much as possible in this conversation, unpack some of those insights, much further. I want to ask you three very targeted questions, right? Yeah, this is like closing segment, and it's really around myths. There's so many around climate change. Just to ask you, what would be the weirdest myth you've heard around climate change? Like, I mean,
look, I think that the myths abound.
Yeah,
right? The myths, the misinformation, the disinformation about climate change. But as a scientist, I think that you always have to circle back to the science.
Yeah.
There is more than enough evidence that is right there in front of all of us of the climate that is changing and of the impact that changing climate has, right? So I think that it's okay for people to indulge in their conspiracy theories, but I think that as an advocate for science, what we would always recommend to people would be that you have to think long and hard about the impact of the conspiracy theories that you share or advance. Because at the end of the day, whilst these myths may be and continue to be in circulation, there is more than enough evidence from the science to tell us that the climate is changing and that it would have an impact. Now, this impact will be felt by lowest income households and women and children. I think that that's more than enough premise for me to take action. I would not necessarily want to indulge in some of the specifics around the myths or conspiracy theories, because at the end of the day, the science already refutes them. So I think that that's something that we should always center back on.
Absolutely, and the fact that your work centers a lot around women and young children, and that's really crux of what the Corona Management Systems team is doing using data technology, and very commendable. My second question is, if you could institute a universal law to help address the climate crisis, what's one thing? I like how you said about malaria. If there was a silver bullet, if at all there was a silver bullet, it would be for everybody to use mosquito nets.
So is it a universal law or Nigerian law? I need to be sure which one it is.
I mean, you could give it in whatever context, really. What one thing would you say would be a possible silver bullet, right, to address the climate crisis?
Unfortunately, hard problems require complicated and complex solution mixes, right? I don't see a silver bullet.
Especially for one that's almost invisible. So,
I don't see a silver bullet. I don't see any version where we figure out what one thing can help right? I don't think that's really the world that we live in, right? There are people who can say, well, we need to sort of control carbon emissions. It's a difficult conversation to look at a low middle income country that is battling significant levels of poverty and argue against industrialization because they need to reduce carbon emissions, right? That's a very hard conversation to have with anyone, no matter what the context is, right? So when you think about it, if you're having that conversation with people and saying, well, we need you to slow down on industrialization, how are you providing capitalization for that country to then drive the infrastructural growth or close the infrastructural gap that they need to be able to help them make up for the losses from an industrialization agenda? It's a very difficult conversation to have, right? So these are not simple, they're wicked problems that require complicated solutions, that require leadership to ultimately deliver. So is there one universal law I'm going to offer you? Absolutely not. I don't think that there's one that exists. But I think that from my perspective and from a very selfish perspective as a Nigerian, I would like to see stronger country leadership on intersectoral collaboration on the climate journey. I would like to see stronger commitment of resources to building resilience in the health system and at community level for climate events. I think that those are two things that for me I would consider a priority as a Nigerian. If I see stronger country leadership that is focused on intersectoral collaboration, right? There is strong leadership, but how does that leadership help us drive intersectoral collaboration? And I start to see that there's more investment in health systems and community resilience to climate events. That for me would be, quote unquote, my recommended magic bullet for Nigeria. But otherwise, it's a complicated problem that requires real thinking and thought partnership to find solutions.
Absolutely. Basically, the last question actually is, what conversation would you like to hear, right? And who would you want us to invite as the next guest? Right?
That's a trick question.
Yeah.
Well, I mean,
to speak to the issue.
So, practical guy, but also a money guy. I would say very realistically, if I wanted to get one person into a conversation about the climate crisis and what Nigeria needs to be doing, I'd like to talk to somebody with financing capacity and muscle. So whether that's somebody from the Afrexim Bank or from the African Development Bank or from the World Bank or the IFC, as the case may be, but colleagues with access to the kind of resources that the country will need to tap into to help us to mitigate and adapt to climate change. That would be one person, or that would be the persona that I would want to hear from or sort of see in conversations, right? And just in terms of wrapping up statements and just thinking through all of this, I think that we should all come to terms with the fact that climate change is real and that we're already starting to feel the effects in our health and community systems. We need to step up our advocacy efforts to help drive government action in those areas. And from a government perspective, we need to continue to foster intersectoral collaboration and start to think about how we mobilize resources to invest in climate resilient health and community systems. Otherwise, as a low middle income country with a large proportion of poor people, we will end up bearing the brunt of climate events and climate effects. And ultimately, that would be not in our best interest really as a country and as a people. And I think that for me, that's really how I would like to end the conversation.
Thank you so much, Chijioke. Thank you so much. This was a wonderful conversation. Shout out to Corona MS and what you guys are doing. They're a proud sponsor of this podcast and the conference, the Future of Health conference this year, our 10th special edition. And here we wrap up the Break It Down podcast, Climate Conversations. Thank you.
Thank you. Have a good day.